afternoon, everyone. My name is Rachel Orr, and these are my audience members. I only have 3 audience members right now because of the coronavirus pandemic with the quarantine and shelter in place that's been issued. So my audience members are a little limited right now, but we'll work with it. I will be speaking on circumcision, if it's a right decision or not. So current parents, aspiring parents, or even people who have not thought about having kids yet, have you ever thought about the decision that you would make that could affect the life of another person? So, although many parents, they are against circumcising their babies due to the negative opinions of how it can be potentially dangerous or it can be harmful to the baby and to their future, and also religious reasons, circumcision is actually very important because it prevents problems in the future that I will discuss with you in my speech. So it is important to understand why circumcising your baby is more beneficial than it is harmful for them. Circumcision is a very controversial topic because it contains a lot of negative opinions, like I mentioned earlier with religion, or how they're afraid of the harmful risks that are involved. And I would like to inform you about all the positive outcomes of circumcision and how religion plays a role in the topic and how the procedure is performed. So to start, I would like to discuss what circumcision actually is, to give you, if you're a teenager who do not understand what it is, or a parent who just needs to learn more about it before making the decision. So the circumcision procedure is when a newborn male is typically circumcised in a hospital a couple days after birth. During this procedure, the baby boy will lay on its back restrained, which sounds a little whatever, but it's just to prevent them from getting near the area while they're doing the procedure. And so I will give you a little bit of facts provided from articles. So in this article, the Mayo Clinic states that at the beginning of the procedure, the doctor will numb the penis by injecting anesthetics at the base, or they can use like lidocaine cream instead of injecting it. That way it's less painful for them, I guess. Then the ring will be attached at the base of the penis to allow the surgeon to, allow the surgeon to remove the excess skin at the top. It's called the foreskin that they're cutting off around there. Once the skin is removed, antibiotic ointment will be applied to the area to prevent any signs of infection. After the baby has the procedure, he is now able to go home with his parents. Now the parents have to do some aftercare, cleaning it every day and putting on some antibiotic cream. And the best care for your baby afterwards, that has been recently researched, is by just showing them love, skin-to-skin contact with the mother, and also just taking care of it with ointment daily. According to the Mayo Clinic, problems after circumcision are very uncommon. Typically, it's a very successful surgery. They're fine in like a week or so, or even 10 days after the procedure, and then they're back to normal and they are able to recover very quickly. So now that you know what circumcision is, I will explain how religion plays a role in the decision process. So it's different for certain religions. The role religion plays in circumcision is that certain religions such as Judaism or Islam regularly practice the act of circumcision among male members. However, there are cases where circumcision is viewed as cruel among Muslims, and they differ on whether circumcision is necessary for Muslim members. So Jewish members, this is also common. Now, some believe that circumcision is like a sign of covenant with God, where the circumcision procedure has been practiced among Jews for about 3,000 years. Jesus was circumcised, and so in the book of Genesis, it states that God instructed Abraham to ensure that all Jews would be circumcised after that. Now, Jewish opposition in circumcision has become more common today because they are unsure if the removal of the excess skin is necessary if you are a Jew. So if you're a Jew now, they're kind of contemplating whether or not it's a necessary procedure or if they can just keep going on life without the procedure. But according to the Religion and Circumcision article, opponents also insist that the Torah does not allow another person to be harmed. So this is where, so the Torah is the Jewish holy book, and it is stating that another person should not be harmed, so they're considering this procedure to be harmful to babies. Now, Muslims are the largest group to circumcise boys because they believe that it protects them from diseases and from potential infections in the future. But according to the Religion and Circumcision, the article for boys, circumcision is seen as the introduction of the Islamic faith and a sign of belonging. So a lot of them are believing that if they're circumcised, then they're a part of their religion, a part of their Muslim belonging. But if you're not, they're still contemplating whether or not they can be involved in that Muslim group just because of that procedure. So, although circumcision in Islam is strongly encouraged, it's not enforced among all the members. And men who convert to Islam, so people who are not already Muslims born and they convert to Islam, are encouraged to undergo the operation as a full-grown man, which is more painful than if it was as a baby, because a man will remember that when a baby typically does not remember the procedure, since they were so young when they had the procedure performed. But lastly, now that you know what circumcision is and how religion plays a role, let's discuss how circumcision is beneficial. So these are the positive effects of circumcision. So circumcision has multiple health benefits that decrease the risk of possible health concerns and infections in the future with the penis. So circumcision decreases the risk of acquiring a urinary tract infection, UTI, sexually transmitted infections, or STIs, and penile cancers, buildup of bacterium, and inflammation of the penis. So, the article I used was the Mayo Clinic, and they stated that the American Association of Pediatrics, the benefits of circumcision outweigh the risks. So, even though there are potential risks, very slim risks involved with circumcision, the results of circumcision far outnumber the risks that are involved. Although there are limited risks of uncircumcised males, circumcision is highly recommended at the infant state, right after birth, so that the male does not remember the procedure performed. So like I mentioned earlier, when a baby is born, their mind is still developing, and they're so young that they hardly remember their memories when they're an infant. So it's the perfect time to have the procedure performed when they're a baby and first born. Now when a full-grown man has this procedure done, it's traumatizing to the man, and they remember that longer because their brain is already developed and they have the potential of remembering their memories. So, in conclusion, we have mentioned that what circumcision is, how religion affects the decision-making process of circumcision, and what circumcision prevents in the future. Now that you are aware of circumcision and what the procedure entails, you can consider choosing to have your baby circumcised or not. I believe that it is very beneficial for the baby, and I think that it prevents a lot of health risks for the baby once they're older. Now, although the baby may not experience these kind of risks as a child, they may experience them in their later on in life. So you have to consider the potential effects later on in life when they're a full-grown man. And it is best to know all the main facts before deciding something for your baby. And just remember that they can't decide this for themselves, and it's up to you. So, I hope you enjoyed this presentation, and I hope you all have a great rest of your day, and stay safe.